Yeah, look, and I guess that's the important point too, is that, getting any sort of red, watery, sore eye, really having it professionally checked is the best way to sort of diagnose it. But typically we're looking at, there are three types of conjunctivitis. So conjunctivitis is an inflammation of the conjunctiva, and the conjunctiva is the clear tissue that covers the white of the eye and the inside of the eyelids. And so you can have a viral conjunctivitis. We don't tend to see those as often as the other two. And that tends to be a red, watery eye. Sometimes you get some light sensitivity. And again, if you've got any red eye with light sensitivity, you need to be getting that checked by an optometrist or at the local hospital. That's something to take very seriously, any redness and light sensitivity. So viral tends to be a watery eye. Sometimes when we look inside the eyelids, we can see these little lumps called follicles. And that's a bit of a telltale sign that you've got a viral conjunctivitis. Viral conjunctivitis is quite contagious, so we really need to be careful around hygiene, hand washing, and if your partner's sharing the bed, you've got to probably spend a couple of weeks away because of how contagious viral conjunctivitis can be. I think most people are familiar with bacterial conjunctivitis, and that's when you get that red, meaty, really kind of mucky, eyelash stuck together, goopy kind of thing. And managed with some, in Australia, depending on your age, and you can often get an over-the-counter antibiotic for that. And so they're fairly typically easy to see because they're pretty gunky and messy. Then you have allergic conjunctivitis. Now, we were taught that you're looking for, so number one, itchy eyes. Some of the signs you might see, sometimes it can be confused with an early bacterial conjunctivitis. They can be red. There's a certain type of lump that we look for in both of those. If there is mucus, they talk about a stringy white mucus being present in the eye. And again, you can have some allergic conjunctivitis can be quite tricky to sort of pick up because sometimes the signs aren't always obvious. It's, itch might be the main symptom. And, there are cases where it's likely related to the person having hay fever and other kind of general allergies as well. But, itch is probably the number one thing. And then sort of added all into the mix there is the irritation you get from dry eye. And dry eye is very, very common now, particularly a form called evaporative dry eye, where our tear film's unstable, evaporates very quickly, typically because of a lack of oil in the tear film.
And if somebody does have allergic dry eye, they're probably, they're tempted to do a lot of eye rubbing, which, as we've talked about before, I believe is problematic, isn't it? So it's something that, especially if you've got kids who are doing a lot of eye rubbing, it's something that you need to get checked pretty quickly, right?
Absolutely, and you really need to avoid eye rubbing. One, it doesn't really help the situation; it kind of exacerbates it. But there are conditions that are believed to be caused, or if not accelerated, by eye rubbing. Things like keratoconus, where you actually start to misshapen the front of your cornea, and that becomes a much bigger issue. So someone who's got a lot of allergies and itchy eyes really needs to sit on their hands. Absolutely no eye rubbing.